Deputy Minister of Women, Youth and Persons with Disability, Mmapaseka Steve Letsike, says South Africa is grappling with a growing crisis of adolescent and teenage pregnancy, with a significant number of these cases amounting to statutory rape. The Deputy Minister addressed the Adolescent Pregnancy Indaba, aimed at strengthening South Africa's response to the alarming rising rate in adolescent pregnancies and associated social health, development and economic challenges. The Deputy Minister joins me now on the line. Deputy Minister Letsike, good evening. Thank you so much for your time. Welcome to the show. Adolescent pregnancies in South Africa is a massive crisis, and more often than not, we learn that it is statutory rape. And more often than not, it is either close family members or teachers in schools that seem to be involved in the perpetration thereof. Are we making enough strides to protect young and vulnerable adolescent and teenage girls in our schools, in our homes, in our communities?
No, thank you so much. Good evening to you, Oliver, and to the listeners and viewers. Please listen. Part of why we are here having this Indaba is to really confront a much well-coordinated effort. All different departments that are key, whether you're talking about social development, Department of Health, Department of Basic Education, Justice and SABC, all are pulling together. We've seen, of course, in the last financial year that we've hit 117,000 girls that have given birth, and that is between the age 10 to 19 years. And these are interrupting and devastating future for young people. But we have to understand, when we look at the crisis, where is this crisis? Unplanned and coerced pregnancy, indeed statutory rape of our children. Secondly is the issue of potential HIV new infections, if at all we do not address this magnitude, but also the level of gender-based violence in this case. So we know that there is a triangle of vulnerability that traps young girls, and these are intersectional issues of health, social, and structural violence. So there is what we've seen in the other comparison of the previous years before the last financial year, a decline. So something that is happening that we are coordinating is well, but we need to do it faster and more because we cannot afford so many young girls being impregnated.
Importantly here, from the 170, or is it 117? I don't quite hear you correctly on the number there. But from that 100,000 plus, 117,000 little girls who gave birth, adolescent pregnancies, how many cases of statutory rape have been recorded in that same period?
Indeed, the amount of statutory rapes don't match the number of teenage pregnancies that we are seeing. When you look at the statistics that are presented by the Department of Justice in terms of reporting, we are just about below 20%, and this is really on a number of issues. A lot of these cases goes unreported. The mandate of the Department of Health, amongst provision of health services, clinical care, antenatal care services, and so forth, one of the key mandate is also reporting, of this statutory rape. But there are quite a number of issues that we might be mindful of. Some of the girls, in fact, majority may be having sexual intercourse, even if it's coerced or whatsoever, with older people, and this is beyond 5 years. And the research that was presented today was that majority, the gaps is between 5 years and plus going forward, and some goes beyond 20 years and so forth. But there are some adolescent girls that are having sex with their age mate. Now, you would need to understand that there are, in certain aspect, legal implication when you have an older person sleeping with a younger person below the age of consent. But when you have those who would have had intercourse with the same age, it's a different legal dynamic. So yes, the issue of statutory rape reporting, it's extremely low, and that's what we need to untangle. Reporting, it shouldn't only happen at health facilities, it also must happen with homes, schools, and the responsibility must be taken by a whole of society.
Right now, the burden of reporting is on the girl and largely the family. And wherever a older family member is involved in the rape, oftentimes those are the cases that go unreported because families, so to speak, sweep it under the rug and hope to not make a big, spectacle out of it. But should hospitals, clinics, and healthcare institutions who treat and deliver these babies, should we consider placing the statutory burden on them to report should there be a case of teenage pregnancy or at least statutory rape in relation to that teenage pregnancy?
In fact, if you look at the data that is presented by health, even if you've had this number of pregnancies, the health data is demonstrating that not all these cases make it to health facilities. We are picking up, and researchers today were even presenting that there's quite a lot of backyard or illegal activities that are taking place where family members, parents would even take these children into illegal establishment and not providing the necessary qualified and accredited services for these young girls. So the issue is not about whether these young girls find themselves in public health institutions. Some of them find themselves in private health institutions or even in illegal establishment. But also some of them don't actually even get the necessary support. So indeed, the reporting issue must be a responsibility of all. Remember, our Constitution, the Children's Amendment Act, really places our responsibility into taking the best interest of children.
Yeah,
And this is
Deputy
where
Minister,
when we look at
how
the
about
narrative,
schools?
the
Because
research, we have those issues.
how about schools? Because it is teachers also that are able to spot these pregnancies long before a health institution can. Should schools and principals, teachers bear the responsibility of reporting a teenage pregnancy to the police, whether they know it to be a statutory rape case or not? Would be to be investigated at a later stage. But should they bear a statutory responsibility to report such cases to the police?
The children's rights must be protected by everybody, whether in school, whether at home, whether in facilities, or whether even within community members. The Constitution is calling for everybody to protect the rights of children. So even schools will have that responsibility. And this Indaba is focusing on every individual's role. So we will definitely, when the strategy is finalized, we'll have exactly directive in terms of who should do what by when, and the responsibility that must also observe the rule of law, but also work within governance and the best interest of the child.
Deputy Minister, thank you so much for your time. Really do appreciate it.